Welcome to today's webinar, Rural Health Transformation Program, Roots Hub Information Session. Before we get started, here are just a few reminders about the webinar technology. Please make sure that you are using a computer or smartphone connected to the internet, and the audio function is on, and the volume is turned up. Please make sure that your volume is muted for the duration of the call. Questions can be submitted anytime during the presentation using the Q&A feature on your control panel. We will answer as many questions as time allows after the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters today are Talisha Edwards and Melissa Gracia. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the View feature located on the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include opening remarks, an overview of the North Carolina RHTP, Roots Hub details, RFA details, and a Q&A. At this time, I would like to turn it over to Deputy Secretary of Health, Deborah Farrington.
Thank you, Katie. Today's webinar helps us to fulfill our ongoing commitment to maintain transparent and consistent communication about the Rural Health Transformation Program. Joining us today is our Secretary, Devduta Sangvi, who will provide some opening remarks about this unique opportunity that we have to leverage federal funds to address the significant health needs in our rural communities. Join me, please, in welcoming our Secretary Sangvi.
Thank you, Deborah, and good afternoon, everyone. And you said it best. This is a unique opportunity, a once-in-a-lifetime opportunity, quite honestly, for North Carolina to transform rural health. This is a process that we've been engaged in. It has involved each and every one of you, and I'm excited to see the level of response that we have joining us today. You're going to hear more about North Carolina's plan for the Rural Health Transformation Project, and central to this, as many of you know, is this concept of the Roots Hubs. Today's webinar is going to largely focus on what it will take for someone to serve in a lead role, be a Roots Hub lead, and really think about how we transform rural healthcare across the state of North Carolina. There's a lot of information in here, and I want you to be able to take it and understand that if you are not able to participate at a hub lead level, that it does not necessarily in any way limit your ability to be a part of this unique project. Our goal is to transform healthcare across all 100 counties. And we know that the rural healthcare needs impact 3 million people who live in our state. So again, a unique opportunity for you to get involved. We know that many of you have been involved with this project from its inception. We had over 420 community partners submit ideas on what we can do. And we're finally getting started with implementing those ideas and seeing what we can do in North Carolina. We'll make the material available after the webinar as well. As you heard, we're going to do our best to answer all of the questions. This will be a little bit of an iterative process, so we're going to need your ongoing feedback to make sure that we excel and are as successful as possible. And with that in mind, I'll turn things back over to Deputy Secretary Farrington. Thank you, everyone, for joining.
Thank you, Secretary, and I appreciate the comments, especially about the fact that it is an iterative process that we need to go, but your feedback is incredibly important as we go through this implementation phase. As Katie noted earlier, just to provide a little bit more context, we're going to run through a brief presentation. We'll spend most of our time hopefully addressing all of your questions, and we want to make sure that we're providing a high-level overview of the Rural Health Transformation Program. As you'll see on this slide, this is a welcome opportunity for our state to transform rural health. This is especially important given the large size of our rural population, the chronic physical and mental health needs of our rural communities, the workforce shortages and the digital broadband gaps that we see in our community, as well as the need for our rural facilities to have the support to maintain financial stability. This next slide reminds you, for those of you who are new to the Rural Health Transformation Program, that we wanted to share our guiding principles for how we go forward in this implementation phase. As Secretary Sangvi noted, we had more than 400 individuals, community partners, and providers provide input that helped us develop our application. But as we move into mobilizing implementation, we have these guiding principles that ground our work and how we go forward. We want to make sure that we maximize all resources to improve rural health. We will build out some details. We want to translate those high-level strategic goals that we outlined in our application into actionable steps that have clear timelines, responsibilities, and measurable milestones that we can hold ourselves to. We want to achieve some quick wins and implement those initiatives that are going to deliver immediate, visible benefits to our communities and our partners. This is especially critical in year one while we're building momentum for long-term success. And as you may have heard, our year two funding will be predicated upon the success we achieve in year one. So achieving those quick wins is essential. We also want to plan for long-term sustainability, and our initiatives must include a sustainability plan. The funds that we hope to receive will last for 5 years. We want to build on the innovation and success that already exists in North Carolina and make sure that it will be sustainable for years to come. We want to measure and prioritize measurable community impact, and we'll do that by getting input from community members, and we want to be flexible, and the Secretary said it, we want to be agile and iterate as time goes on. And finally, that's part of the reason we're having today's webinar is we want to communicate transparently and with integrity throughout the process. This next slide is a review of the 6 initiatives that are a part of our Rural Health Transformation Program. RHTP is built around these 6 integrated initiatives, and it begins obviously with the NC Roots Hubs, which we'll talk about in more detail today, which are these locally governed networks of a lead and different entities that are part of that network. We want to expand primary care and prevention. That's our Initiative 2. Initiative 3 is focused on expanding behavioral health and addressing substance use needs of our rural community. With workforce, we want to build a resilient workforce, attract and retain individuals to stay and work in North Carolina. That describes our Initiative 4. Initiative 5 is focused on fiscal sustainability and building those innovative models that we hopefully can support long-term to support rural providers in their ability to continue to offer care. And finally, Initiative 6 is focused on modernizing our rural care delivery system through digital solutions. Our success factors, which you'll see some samples listed across towards the bottom of that slide, and performance objectives, these measures are focused on reducing chronic disease, improving access to care, addressing our workforce vacancies, and making sure that we adopt various technologies in our delivery system. CMS has given us some guidelines that these rural health transformation funds are not to be used to supplant the Medicaid cuts, although we acknowledge that the cuts that we've seen are significant. We also have to make sure that our projects have measurable outcomes, and the funds cannot also support activities that are siloed or not focused on addressing rural impact. This next slide talks about how we focus our efforts in year one, and a lot of our activities will be focused on building that foundational infrastructure, setting up the governance that we need, the staffing infrastructure, and achieving, as I mentioned earlier, some quick wins. We believe that steps that we take in year one will build success for a sustainable future with rural health transformation for the years to come. The Roots Hubs are going to be the anchor to many of these efforts, ensuring that the change that we put in place will be able to be sustainable over a period of time into year 2 and beyond. For this next couple of months between now and the end of March, we've listed here some key milestones that we'll be focused on. We have submitted our revised budget to CMS for year 1 funding. We will also be focused on establishing, as I mentioned earlier, the programmatic and governance structure that will help guide our work. And we will be releasing the request for application for the Roots Hub lead entities. During this period, we obviously will begin a silent period during which we will have to exercise a lot of caution and protect the integrity of the procurement process, and that will happen as soon as we release that request for application. Between April and October of this year, we will be focusing on additional implementation activities, including going through the awards process for the Roots Hubs. We will select the Root Hubs lead and also make sure that they're onboarded. During this period of time, those regional hub leads will be developing first completing an assessment, but then developing their action plan, standing up the governance structures that are necessary in order for them to implement these activities. We want to also be able to expand the reach of our North Carolina Rural Health Transformation Program. So there'll be some things that we will stand up at the statewide level that will help to push more dollars out into the community and help us implement some additional activities beyond those that you will see with the Roots Hub network. We will submit our first annual report to CMS in August of this year, and we will continue to have open and transparent communication with you as our community partners through webinars like the one we're hosting today and ongoing engagement out in the community. And just to emphasize, the activities that we're focused on in this first 7 months or more of this first year are going to be looking towards how can we demonstrate impact and how can we set ourselves up to get funding in year 2. Slide 11, we're going to jump right in to what is the Roots Hubs. Roots stands for Rural Organizations Orchestrating Transformation for Sustainability. So it's Roots Hubs. These are regionally, locally governed networks of community partners that implement the initiatives that you saw earlier that are part of our program. Slide 12 gives sort of a visual of how our Rural Health Transformation Program will be carried out, and the Roots Hub regions will align with the NC Managed Care Standard Plan regions that some of you are familiar with. The Roots Hubs will serve as these regional anchors throughout those 6 regional areas and help drive transformation in those regional communities. The next slide, slide 13, talks about the specific responsibilities of the Roots Hub lead. The Roots Hub leads will receive resources to build the foundational infrastructure and launch priority programs that are part of the Rural Health Transformation Program. They are the organization that's responsible for bringing together partners in this regional network, and those partners will collaborate with the Hub lead to develop the priorities that are focused on improving the health of our rural communities. Each region will have an opportunity with the leadership of the Hub lead to customize the activities and the package of services in that region that are targeted to best bring impact in the region that they're leading. The investments that we pass through the Roots Hub leads will enable the hubs to address the immediate needs of those community members while building capacity for long-term sustainability. And you see here a visual of how the Roots Hubs lead will establish their overall governance structure. And this provides some clarity about some key next steps that the Roots Hub lead will take. They will need to set up their governance structure, and I will note that that governance structure is inclusive of organizational leadership, obviously within the Hub lead organization, but it also needs to include community members, provider organizations, health systems. And those of you who have read our application know that there is a strong emphasis on the Hub leads, making sure that there's partnership and collaboration, that the solutions that are developed are community-led and community prioritized, and it is through this governance structure that will include community members that those priorities and priorities of the community will be addressed. The Roots Hub lead will obviously be responsible for receiving the grant funds and the resources from the state and awarding those funds down to subrecipients or subgrant those dollars to partners. And I just needed to slow down. I apologize to our interpreter. I know that I'm talking really quickly. The Roots Hub lead will bring together providers and partners to work together to create this local network. And you see across the bottom of the screen some examples of different types of partners that'll be a part of that network. Next slide. Here are some additional details about the Hub lead key responsibilities. They will, again, be responsible for making sure that they, in the establishment of their governance structure, onboard those partners and providers to help complete some of those key early tasks, the needs assessment portion, the development of that action plan. They will assess the regional needs and make sure that they align their work with the partners around those shared community priorities and around that action plan. We specifically expect that the Hub leads will implement a tribal engagement plan that includes decision-making protocols that respect tribal sovereignty. The lead organizations will establish standards to make sure that rural residents are effectively connected to physical health care, behavioral health, and other social supports. They will facilitate funding of applications and obviously manage that subaward granting process that aligns with the action plan and the needs of the rural community within the confines of the grant requirement. They will need to be able to monitor their progress on RHTP goals, and they will do that by collecting and analyzing data that demonstrates how they are performing and what outcomes they are achieving. And that will include their tracking of certain KPIs. All right. To succeed, we believe the Hub leads needs to have some core operational capabilities. And you'll see that we have organized those capabilities into 4 buckets. And I won't read each of the items in the columns, but just sort of summarize for you the 4 areas. So those 4 areas include network and subrecipient management, funds distribution and financial oversight, data and analytics, and community-led solutions. So within the first column, the first bucket of work, you'll see the network and subrecipient management responsibilities. And those activities and operational capabilities focused on how the Roots Hub lead will manage the award, the contracting process, the implementation of those operational plans, how they collect and store data, and how they generally manage and oversee the network of providers and partners that are part of the network. The second column, funds distribution and financial oversight, is focused on the actual payment and financing part of their responsibilities. So being able to receive funds from the state, being able to track and accurately distribute funds and report on how those funds are used. So this organization needs to have the capacity to manage the funds that are coming in from RHTP, have the sufficient audit trails, and just document how decisions are made. In the third column for data and analytics, it's about how they both ingest, manage, and track data in a HIPAA compliant way, I'll say. And then the final column, community-led solutions, is all about making sure that the activities that are happening in the region are in fact community-led, that there's strong partnerships that exist, partners have a voice and a seat at the table, and that their input is considered and shows up in the plans that are developed. And so I'll go quickly through these next couple of slides that are focused on how the hub leads have a responsibility within each of our 6 initiatives. So initiative 1 is the establishment of the hub networks and the hub lead. For initiative 2, which is focused on physical health and chronic disease, the hub will have a leadership role in what we've talked about earlier, assessing the needs, funding the projects that are important to that region, and directly funding the activities that are part of the initiative 2 area. So the hub lead will have a responsibility for coordinating and directing initiative 2, and the funds for initiative 2 will flow through the hub leads. Initiative 3, the hub leads will expect to have a collaborative, connective role with our behavioral health and mental health and SUD services that live in Initiative 3. But they will not be directly responsible for managing that, that Initiative 3. Slide 18 covers the final 3 initiatives, beginning with Initiative 4, which is workforce. And the hub leads will have a responsibility for carrying out the Initiative 4 activities as a part of our RHTP. And so they will establish those core workforce needs for the region and help to develop the strategies that are necessary to address those needs. They will directly fund the workforce projects in Initiative 4. Initiative 5, financial sustainability, which includes some of our value-based payment models. The hubs will directly fund those activities that are part of Initiative 5. And then Initiative 6, the hubs will have a coordinating and connecting role, but they will not be responsible for directly carrying out Initiative 6, which is focused on digital solutions for rural communities. For slide 19, this provides you a few more details about the request for application for the hub's lead entity. If you look at the left side of this slide, it provides some details about what will be in the RFA that we intend to release very soon. And I'll talk a little bit about the timeline in just a couple of slides. The RFA will detail who is eligible to apply as a Roots Hub lead. We will project anticipated funding amounts, knowing that all of this that we do in RHTP is contingent upon CMS approval, but we will anticipate the amount that each region would be awarded. We will define the scope of services that are going to align very closely to our application. We will provide general information about the application process and the applicants. We will talk about the process for how to apply and how the responses will be reviewed, and we will share the evaluation criteria. In terms of who can apply, public and private entities can apply who demonstrate that they have worked in North Carolina or work in North Carolina. And I want to emphasize as well that entities need to be able to demonstrate that they can work on a cost reimbursement basis, which means that they will incur expenses and pay out claims and then submit those requests for payment to the state, and we will reimburse them. In terms of further eligibility criteria will be defined in the RFA. And we're getting close to the end here. Slide 20 reviews a more complete list of components of the application. And I won't go through all of this, but you'll have these slides to reference, but it gives you a detail about what is going to be in the RFA. Slide 21 is the timeline and key dates. We will post the RFA to our Rural Health Transformation Program website tomorrow. Entities that are interested in applying, we should submit a letter of intent by March 6th. We will have a question and answer period. So although we may not answer all the questions today, we will have a question and answer period during the RFA that begins on March 13th. Applications will be due by April 2nd. We will review those applications during the month of April and hope to award the RFA by May 1st. We'll have a 30-day contract negotiation period and expect that Roots Hubs will start on June 1st. Well, thank you all for allow me to review all that information. We now have time to do questions and answers, and I would ask that Heather Strickland, who's our Director of Communication, will join us and help us navigate the questions that we've received. Heather?
Thank you so much, Deputy Secretary Farrington. We have a number of questions coming in through the Q&A portion and in the chat. The first one, what are your quick wins and within what time frame?
Thank you. That's a great question. So some of our quick wins obviously are the release of this Roots Hub RFA is really key because in our original application, and you may have saw on an earlier slide, we had actually intended to launch all 6 Roots Hubs by year 2. And we have significantly sped up that process. And so we're launching those hubs in year 1. That's an example of a quick win. Also, we have prioritized and accelerated the implementation timeline for some of our behavioral health initiatives. Our first episode psychosis program. We want to do some more with our mobile outpatient treatment programs. Focus also on maternal mental health as examples. We also want to launch our work in the HIE space and move quickly towards implementing our Rural Health Innovation Funds as an example.
All right, next question. Will rural emergency hospitals be eligible for funding?
So I think we have said in our application materials that there is a variety. Yes, the short answer is yes. Applicants that apply and are deemed qualified, like rural hospitals, can definitely be selected. But we will need to go through that selection and application process, but they're an example of an entity that can apply for funding.
Thank you. Next question. Can you please elaborate on what expand reach of existing statewide efforts aligned with NCRHTP will entail in the April through October time period, as described in one of the slides?
Thank you. If you see me looking to the left, it's because I'm referencing the slides that we reviewed earlier. I will answer that this way. We know that the Rural Health Transformation Funds are a unique opportunity, but it is only for 5 years. And we were intentional in our application to indicate that we want to build on programs that are already existing in North Carolina. We feel like we have innovation in North Carolina and opportunity. And so when we talk about build on or expanding the reach of existing programs, that's what we're talking about. Another example of that is you all know that we had more than $835 million, I think, dollars invested in our behavioral health system. And while that was very much welcome and needed, there's still greater needs in the behavioral health space. That provides another example how we can leverage some of these federal dollars to further expand our reach and do more in behavioral health, as an example.
Thank you. Next question. For smaller community organizations looking to partner with organizations that will apply to Roots Hub, how can these smaller community organizations reach out to get connected to a partner?
Heather, can you read that one more time? I just want to make sure I understood it.
Sure. For smaller community organizations, how can they get connected to one of the potential Roots Hubs partners? I shortened it just a little bit for you.
Okay, thank you. I will say that one of the ways that we will expect, and I think that we've emphasized this, that the Roots Hub leads will have that coordinating and outreach responsibility. So while, yes, we want the community partners to get connected, a lot of responsibility will rest with those hub leads to engage with community partners to make sure that they have a voice. We will certainly publish on our website those entities that are selected when we get through the procurement process, so that any community-based organization that wants to get connected to a hub lead can certainly go to our website and access information there about who are these organizations, and they can reach out and get more information by contacting them directly.
Thank you. Next question. Will each hub lead set up their own governance plans and standards as opposed to a more centralized approach?
So I think that we will see what we get in terms of responses. And I think we will detail, and you'll see when you look at the RFA, sort of the parameters that are established for how the hub leads need to collaborate. And so I don't feel completely privileged to sort of get into the details of the RFA in that regard, but I do believe that we'll be clear about the expectations around coordination. And then the applicants will be able to define kind of how they expect to address that coordination and leadership, because it'll be a part, as I think we've emphasized a couple of times, a part of their establishing their governance, or they'll have to explain how they're establishing their governance.
Thank you. Next question. What are the requirement steps to become a community partner?
I think that this RFA is focused on the requirements of the hub leads. And there is a slide, and I don't believe I have it with me, but you can access it, I'm pretty confidently, on our website, where we define the responsibilities and role of the hub lead organization, and then we define the responsibilities of the network partners. And I don't know if anybody has access to that, but that's a slide that we've shared in some of our community meetings that just sort of gives some guidance about what might you be expected to do as a community partner. You know, bring your voice to the table, share information about your experiences. And so our responsibility, obviously, and our governing authority will exist with those hub leads, but we do expect, we will need and expect that community partners will be helpful in the process.
Thank you. Could you go back to the timeline slide and just run through that again? I think folks missed some of that, and we've got a lot of questions about the timeline. So maybe we can back up the slides. Thank you.
Absolutely. I'm happy to review this and maybe at a bit of a slower pace. So it's this Friday that the RFA will be posted to our RHTP website. And then letters of intent will be due on March the 6th, and the RFA will define the expectations around the letter of intent. Any questions that a potential applicant has about the RFA needs to get to us by March the 13th. And then we will require applicants to submit their written responses by 5 p.m. on April the 2nd. The April 3rd through 30th period is for the department to review the applications that we receive. And you can see by this time line that we're expected to work very quickly to make an award notification by May 1st. We will have a 30-day period between May 1st and May 30th to do contract negotiation. And I will note that this is a request for application that will then be followed by this period of contract negotiation. And then we expect that the Roots hubs will begin on June 1st, would be the start date.
Thank you. How many awardees will there be?
I think we've said in our application, and a lot of stuff that I'm going to cover today is information that's publicly available because we do want to protect the integrity of the procurement process with the release of the RFA tomorrow, I'm sorry, with the release of the RFA tomorrow. But we've said that we expect to award up to 6 Roots hubs to align with the 6 Medicaid standard plan regions. Thank you for getting back to this slide. So as the design is that we would have Roots hubs covering each of these 6 regions.
Thank you. Next question. Will applicants need to include all potential community partners within the RFA response?
Will applicants need to include all partners in their response?
Potential community partners in their response.
That will be defined in the RFA. And what we're looking for, and we've said this, I don't think we can say it too often, is we want to see that communities are represented in the implementation of RHTP. We believe that that's the only way that this is going to be sustainable and that it's going to be targeted to the needs of the community. And so we want to be able to see that there's a diverse representation of communities so that you can appropriately understand and prioritize the needs of those communities and address them through the plans that'll be developed. And consistent with what we've said all along is we sort of give some broad parameters around who those community partners are, and potential applicants can sort of detail who they plan to engage with.
Thank you. Next question. Do community priorities need to specifically align with the RHTP outcomes to be considered for funding, or will there be funds available to fund community priorities?
That's an excellent question. And we do expect that the Roots hubs with the lead and the network will develop activities that align with the parameters of our Rural Health Transformation Program. And then we've said it, I think, even in our application, that Roots hubs can also propose activities that are specific to the Roots region that they're covering. So I think that short answer is yes. The Roots hub can propose things that are unique to that community. And I will say, because Rachel would probably remind me to say this, it all has to fit within the parameters of the Notice of Funding Opportunity, right, and the broad parameters of the RHTP. And you will note that we listed those 6 initiatives, and within each of those 6 initiatives, there is a variety of activities. But I think if a Roots Hub region can say, yes, we have chronic health needs, primary care needs in our community, and we believe that this is going to be an effective way to address those chronic needs, then the application, our Rural Health Transformation Program application said that we would consider that.
Next question. Can you share more information about Area 6, the digital health? If the hubs are not responsible, how will this be implemented?
I'm going to ask Walisha if she's available to come on so we can get some additional voices in to talk about our plan for implementing Initiative 6. Alicia, are you available?
Yes, I am. Thank you so much, Deborah. And that's a great question. So we're excited to enter into some inter-cabinet agency collaborations around Initiative 6. So they're going to be key efforts to support our Rural Health Innovation Fund. You would see that reflected in the application, where there are funds be available to support infrastructural enhancements for various folks who provide healthcare services to rural communities. We have robust activities already going on with our Department of Information Technology with broadband expansion. So we're really looking to augment some of the work that's already been done here in the state that we're known for, the innovation in those spaces, and leverage these funds to expand that work. So the hubs will be involved in coordinating and ensuring that the information and opportunities are getting to the partners and communities that they're serving. So again, our goal is to augment what's working. A lot of innovation has been happening in North Carolina around digital health. And so we're really going to tap in year one to advance that work. So great question. Thank you.
Thank you. Next question. Can Roots Hub's leads be awarded more than one region?
Those details will be provided in the RFA.
Are all counties in North Carolina eligible?
Yes, I'm going to ask Rachel Cooper to come on camera and address how we are defining county participation.
Great. Yeah, as Deborah said, we want to make sure that these dollars are going to rural communities, and we believe that the hub networks and the hub leads are in the best position to identify the unique needs of their rural communities. And so you'll see more details in the RFA, but we're not excluding any counties. We're just there'll be more details in the RFA on that. Thanks.
Okay, thank you. We have a request to show the slide that includes the application content. So can we put that back up? And then while we're doing that, the next question, how can stakeholders be considered to be included as a member of the hub's governance structure? How will stakeholders be engaged in the needs assessment?
Those are excellent questions. And I think you will see in the RFP, and we've talked a lot in our overall program application, that the hubs need to demonstrate strong community partnership and leadership. And we've talked about the fact that the governance is more than just sort of organizational leadership, that the governance includes sort of the oversight of how this rural health transformation is going to be implemented in a particular region. And so I believe that we'll see once we get responses back how Roots Hubs intend to address your question. And we will have some details, I believe, in the RFA with how Roots Hubs can demonstrate how people get involved in the governance structure.
Thank you. Next question. Will there be a list of who the Roots Hub's partners are for each initiative with contact information so interested parties can contact them directly?
We will post information of who is awarded Roots Hub leadership lead role on our website. And Heather, I think I'll have to find out what kind of protections there are around sort of information we disclose, but we will absolutely publish who the awarded agencies are. And that will be a way I hope that community members will be able to reach out to them and get connected. Are there any, you can address any restrictions we might have in that space, Heather.
All right, next question. Will each hub be assessed with standardized health process and quality metrics?
Rachel, you can address how we outlined, if you wouldn't mind, Rachel Cooper, how we outlined our metrics in our overall application and what folks can expect to see from that.
Sure, happy to. As Deborah mentioned, we have about 26 indicators in the application that was submitted to CMS. And really that's the starting point for how we think about measuring success over the 5-year program. The Roots Hubs will also have specific measures and will be expected to kind of also tailor some of their KPIs towards the package of services that they choose to implement. So more to come in the RFA, but a good starting place is, I think, in the page 54, if I'm not mistaken, in the application. Thanks.
Thank you, Rachel. And your reference to page 54 is the North Carolina Rural Health Transformation Program application that was submitted to CMS and is on our web page, includes a list of all of those measures that you just referenced.
The next one is a RFA process question. How will you manage the Q&A once the RFA is released? Will there be a rolling Q&A or defined Q&A period?
I believe our timeline slide, and you'll see this, indicates that there will be a defined Q&A period for the RFA. I will say that we do have on our website an ability for folks to submit questions. And so you should feel free to do that. Submit questions about RHTP. And just a reminder that once we release the request for application, we will go into a silent period. And that silent period is going to begin, I believe, when we release the RFA on Friday through when we complete the contract negotiation period. And so there will be a limit, I think, to what questions we can respond to after we enter that silent period. We do intend to continue to engage and answer questions that are generally about RHTP and how people can get involved. Some of the questions that folks have raised today about how can I make sure that my voice is heard and I get involved. I think we'll continue to be able to address those kind of questions and talk about some of those initiatives that live outside of the RFA Roots Hub. But in general, the silent period will begin specific to questions related to the Roots Hub's lead, beginning when we release the RFA tomorrow.
Thank you. We've got a couple questions about the type of organization that can apply. Can we go back to the slide that shows the capabilities? And Deborah, can you just give us another overview of that one?
Yes, I believe that is, yes, that is the slide. Let me see what number we're talking about. Slide 16. I think we could also look at a bit, let's start there and then we'll roll into slide 19. All right, you all, that's kind of small. I'm gonna have to use my own screen. So the hub lead capabilities, one of the things that I think is important, and you will see it again on slide 19 when we go there, don't advance there, but one of the things that's really important is that this hub lead organization has the capacity to manage the community or network of partners that exist. And you see that those management responsibilities are sort of listed under the column that's defined network and subrecipient management. So being able to bring together this network of community partners, organize the work of those community partners, manage decisions and how information flows, including the contracting process for those community partners, having standardized ways to communicate with those community partners, and also having ways to collect, review, and transmit all kind of reporting data. And those of you who've worked successfully with CMS knows, based on the experience and the notice of funding opportunity, there will be lots of reporting that will be required. And so that organization who is operating as the hub lead needs the capability to collect, review, store, transmit data across their network and to the state agency. In terms of fund distribution, I want to be sensitive to time. In terms of fund distribution and financial oversight, you will see emphasized again that the organization needs to have the capacity to grant and subaward dollars through the hub lead agency and then track those distribution of funds at the initiative level and at the activity level as listed here and at the cost category level, because that is data that we will need to collect for reporting purposes and potentially share with CMS. That organization needs to have the capacity to have payment workflows. Cash management will be key because we want this program to be successful, and being able to manage the dollars that flow from the state down to through the regional hubs down to those regional partners will be key. and operating on a cost reimbursement basis and not sort of having the sufficient capital to do that will also be important. You see a reference to maintaining sufficient audit trails. We anticipate that there will be a lot of interest. There is already a lot of interest in RHTP on financial accountability and making sure that we're using these funds as they have been intended and that we're achieving the outcomes that are intended for the program. And then being able to document decision pathways, how funds are distributed, why funds are distributed, reflects a little bit about those decision pathways. In column 3, data and analytics, being able to, as I've mentioned, be able to collect data securely, store data, and distribute data. Data analytics will be important, being able to understand the outcomes that are being achieved, and the ability to measure, I think, those outcomes and other key KPIs will be important. Organization needs to be able to share data, not only with the state, but with community partners who want to understand how the funds are being used and what outcomes or process or health outcomes are being achieved. So being able to have dashboards that demonstrate that will be important. And then there's references to data security and encryption that meets the industry standards around that. Community-led solutions is the final column, which emphasizes the need for the hub lead organization to partner with local leaders, organizations, and individuals to understand and identify the priorities of the community and to co-design with community members solutions that are reflective of the needs. Our state is very diverse and each of our communities are unique, and the hub lead will need the capacity to be able to bring a broad variety of voices together and be able to synthesize decisions down to what are the things that these dollars will be able to achieve. And then bringing together a variety of kind of partners, healthcare providers, community-based organizations, public agencies, working together to achieve a shared goal. And I will say this and then come back to you, Heather. Part of what we believe is essential for sustainability is being able to direct these dollars to the right activities. And we know that the communities know best what's going to work. Each of the regions know best where the services are and where the gaps are and what's going to work best in that community. And we believe that's going to be the best opportunity for sustainability. And that's the reasons why we designed this program, to put the decision making down in the local communities in these regional hubs. Okay, I'll get off my soapbox, but it's important to us.
I think it was great. Thank you. Time for just a few more questions. What will the relationship reporting structure be between the Roots Hubs leads and the state?
We will define, and I think we may have put some of this in our North Carolina application to CMS, and I'm going to ask Rachel to keep me honest. I believe we defined in that original application what the hub leads responsibilities were. We talked about the network partners have some responsibilities, and then we defined what the state's responsibilities are. So, and I think that all of those things will translate into what you see in the RFA. But Rachel, is there anything you'd add to that?
No, I think that's right. I think, yeah, there's a bit of a snippet in our application to CMS that kind of defines those responsibilities, and then a more detailed version of that will be in the RFA.
Thank you.
All right. Probably one, maybe two more questions. Will the Roots Hubs leads develop their own RFPs for sub-awardees? And if so, where will those be tracked or posted?
That's an excellent question. And I will defer to Rachel. I believe that those details are defined in the RFA, but Rachel, is there anything you'd add about that that we would expect the Roots Hubs leads to tell us?
Yeah, I think we will be looking for that in the RFA, so there'll be more detail there and sort of more guidance on sub-grantee management. Thanks.
Yeah, and part of the reason, I'll just say to add, part of the reason we want to be careful with what we say about the RFA is we want sort of the details of the RFA to stand on its own. Obviously, we're not referencing that document while we're doing the town hall today. And so our continual reference back to the RFA is just because we want to make sure that maintain the integrity of this process. We want to make sure that the facts sort of stand on their own, and that when you all see the RFA tomorrow, you'll be able to sort of get some of the specifics. And we are also tracking the questions that we're receiving today as a part of sort of our deployment of the RFA process. So your questions are not going to be lost, but we just want to be careful that the information we provide as an answer is accurate. And part of the purpose of today was to give you all a heads up that the RFA is coming, and that it will address sort of some of the areas of concern and interest that you all have. And so although we may not have all the details that we can sort of articulate today, they'll be there for you to reference tomorrow.
And that is a perfect segue into our last question. Are Roots Hub's lead able to engage partnerships to implement some of these capabilities?
That's a great question. And I think that I would refer you back to the roles and responsibilities of the document we reference in terms of what the Roots Hubs can do versus what networks can do. I will say generally too that the state's interest is to make sure that we are accountable to CMS, and that the hub leads are accountable to us. And so we would expect that ultimately the responsibility for fulfilling the responsibility of sort of what is in the contract lies with that hub lead. And I think, certainly hub leads can define how you intend to accomplish your responsibilities and meet your contractual obligations, but we will be contracting with the hub leads, and you will be accountable for making sure that you're fulfilling your capabilities.
All right, Deborah, I know we are approaching time, so I will turn it back over to you to close us out.
Heather, thank you. I appreciate your going through all those questions, and I appreciate you all as audience members joining us. We know that the only way we're going to be successful as a state is to do this in partnership with you. The design of this RHTP program included sort of the central component of having this be community-led, community-driven, organized by regions, and each of you have an important role to play. And we are very grateful for you as partners, and grateful that there's so much interest and excitement, and we look forward to the opportunity to be able to release this RFA, ultimately award them, and begin to have some of the dollars that are part of this effort reach the communities that need it most. So thank you all. We really appreciate your participation. I think we have a slide that tells